We take our architectural drawings, our blueprints, and we feed it into the model, and it lets us see the way patients move through our space. It helps us see what the patient journey looks like for an individual patient, which is very useful.
We are trying to improve the patient journey and to give an excellent service for the patient, because that's, from our point of view, that's what they deserve.
It also helps us to see what it looks like for many patients coming through that same space. Thinking about maybe changing a patient journey or a location in your existing facility and doing things a little bit differently. We want to make sure we have our scheduling right so we don't have bottlenecks. And you can model that before you actually make the change.
Our building is small with limited area, especially the waiting area. Our patients are increasing because our clinic is the only clinic dealing with some communicable disease like tuberculosis, like leprosy and HIV. So we felt that this program will help us in this sense to establish a way or pathway to decrease or minimize the suffering of the patient, especially the waiting time.
Doctors and nurses love this program because it lets us see what it actually looks like in real time.
We can reduce the patient stay in the area as we work in communicable disease infectious clinic, so we can save our patient time, safety, and as well as for the staff also to reduce the time from the patient exposure.
We reached the level that we have to design the patient pathway.
Instead of looking at a spreadsheet with lots of numbers on it, we can look at a model that shows little people kind of moving through space. And you can see a cluster of people which tells you, oh, bottleneck.
So we can know that how many patients that we have booked today, and then how many for the consultation and how many for the treatment and the other procedures.
So you can go back, change some of your assumptions. Maybe it's the way your clinic was scheduled. And then you can look at it again and see if you've recovered that bottleneck. You're also thinking about not just what's easiest, but what is safest and what is providing the best care for the patient. So having your clinicians sit around a table and have that debate, because the model has enabled that debate, is really, really helpful. We've actually used it to model lots of space in our new hospital. And the way we do it is we engage with the clinical teams. So for example, our podiatry team or our ophthalmology team, and currently we're working with our ENT team. And that's doctors and nurses who know their patients really well, know the kind of care they want to deliver, and know what their new space should be looking like in a new hospital. We've used it in thinking about the operating room, okay? So how do we get a patient who's been anesthetized, okay, in the operating room quickly to the recovery room? What's the pathway we take? A software program is an enabler that helps you have that conversation. You can continuously use it to redefine your own facility because things change in healthcare. And that's the one thing we know. In Qatar, for certain, things change.
We feel that this program will help us in the new hospital when it will be open.
It's a chance for HMC to improve their service and to study it in a different way.
We're solving problems in the clinic before we move into the clinics. We're probably solving problems in the operating room before we move into the operating room.
If you will know the problems, you will solve it as much as you can before, going to real life.